Thanks, Carlos. Welcome, everybody. I'm very excited to have you all here for today's presentation, Strong Communities, 13 Ways to Improve Urban Environments. This is the second in a series of webinars exploring healthy community strategies that's being presented by Change Lab Solutions and hosted by the Network for Healthy California. My name is Heather Wooten, and I'm a Senior Planner and Program Director with Change Lab Solutions. And I'm joined today by my colleague, Q Dang, who's a Senior Attorney and our Technical Assistance Legal Director. Q, why don't you say hi?
Hello, everyone.
Just a little bit about Change Lab Solutions. We're a nonprofit that partners with state and local leaders to create healthy communities using the tools of law and policy. And we do that through research, resource development, and trainings like the one you're participating in today. First on our agenda is a quick refresher on policy, systems, and environmental change, or PSE strategies. For those of you who are participating in our first webinar in this series, this will be a little bit of a refresher, and for others who are just joining us, it'll hopefully ground you all in the conversation we're having today. Next, we'll discuss the Network for Healthy California's top 13 policy, systems, and environmental strategies for creating healthier nutrition environments, focusing on approaches in urban communities. Throughout the presentation, we'll be asking for your participation, and we'll also have time for discussion at the end. Please feel free to enter any questions that you might have at any time in our chat box, and we'll get to those as we can. So let's start off by defining policy, systems, and environmental change approaches. What do each of these concepts mean, and how do they work together? Q, I'm not sure if I have your audio there, but I can jump in.
Hello.
So,
hello.
Yeah, go ahead.
I'm back, sorry. Sorry about that.
That was a question for you, Q.
Oh, thanks, Heather. So when we say policy, systems, and environment, when we say policy, we mean a written statement of organizational position, decision, or course of action. These are things such as ordinances, resolutions, mandates, guidelines, or broadly, they're basically rules. Systems are changes in organizational procedures such as personnel, resource allocation, or programs. And environmental encompasses physical, observable changes in the environment, whether that be the built environment, the economic environment, or the social environment. Today, we're going to be talking about 13 PSE interventions, policy, systems, and environment interventions, and they will be located in a number of different settings. When we say strong communities, when the network says strong communities, it's talking about strong neighborhoods, it's talking about strong schools, it's talking about strong work sites, strong retail environments, and strong public places. And when I say public places, I mean government places, or places that use taxpayer money to fund what is being provided in those places. These interventions recognize the importance of creating strong, healthy options for people in all these places. Also, as this diagram kind of shows, there's some overlap among these things. And so we'll be flipping back and forth and entering, moving between and among these settings when we talk about all these different interventions.
Thanks, Q. Okay, it's time for our first poll. We'd love to hear from you. What are your priority environments? So where are you focusing your local efforts related to policy, system, and environmental change? And I'll pull up our first poll if you would go ahead and let us know if any of these environments are a priority for you. It looks like so far neighborhoods are on top. Lots of folks working in schools. Okay, I'm going to close our poll. So by far the top response here was neighborhoods. You all were able to choose more than one answer here. Lots of folks working in schools, and then we also have a good chunk of people who are focusing their efforts around retailers, public places, and work sites as well. Thanks for participating, and as a reminder, you can always use the chat function if you have a question as we go along. So I just want to highlight a first resource put a resource spotlight on the SNAP Ed Intervention Toolkit for states. Many of the examples of PSE interventions that we'll be talking about today draw from this toolkit, and they go through interventions in a variety of community settings, including childcare, schools, and communities.
Great. Our first intervention recognizes that many of the habits and norms around healthy eating and physical activity start at a very young age. So with this intervention in childcare and preschools, qualified childcare centers can self-assess and undertake improvements in healthy eating and physical activity. This includes healthier snacks and meals. This includes making water the primary beverage of choice. This includes limiting the amount of screen time to no more than 2 hours per day. This includes adding or increasing the amount of physical activity to the curriculum, and establishing farm to preschool at early childhood sites. So one thing we're going to be talking about today is we're going to go through the interventions, and then we're also going to go through examples and then resources. So the first example, and since we're going through so many interventions, we're just going to pick one, maybe two examples for each of these. This doesn't cover the entire everything about this intervention, but it's just one example. It's kind of like a teaser, and we have more webinars coming up that delve into these issues, into each of these interventions more specifically. So this first example with child care and preschools is the Farm to Preschool program at the Urban and Environmental Policy Institute at Occidental College. It's an excellent example of influencing young eating habits and increasing access to locally grown fruits and vegetables. This is done through policies that facilitate local food purchases, promotes farmers markets to low-income families, something called a market basket program, which basically delivers a regular box of food to parents, teachers, and staff, nutrition education, technical assistance, and workshops. Evaluations for this intervention have shown both an increase in knowledge and consumption of fruits and vegetables. The website www.farmtopreschool.org is an excellent resource that provides examples like this and many others. We'll also be having a resource page following this webinar where the things that we mentioned during today's webinar and other resources will be listed. So you don't have to worry about jotting down all these URLs. The resource that I'd like to highlight with this first intervention is from the Child Care Food Program Roundtable. This roundtable works with the USDA, the National Child and Adult Care Food Program Forum, and a couple of other organizations like FRAC, the Food Research and Action Center, and the California Department of Education's Nutrition Services Division, as well as California Food Policy Advocates. And they put out this excellent child care handbook with best practices for child care nutrition and physical activity environments. And this is what you could work with child care settings in order to do their self-assessment and policy development. A second intervention, intervention number 2, focuses on kids that are now a bit older. This is the school wellness policies. All school districts with schools that accept federal money for the school meal programs must have school wellness policies. The USDA has minimum requirements for what needs to be in wellness policies, but schools and districts can include policies for before, during, and after school that exceed these minimums or meet these minimums, but exceed is preferable. One example I'd like to highlight of a school wellness policy that exceeds the USDA minimums is from Oakland Unified School District. This is a very strong wellness policy that starts from it has a starting point that wellness is fundamental to learning and achievement. The focus of the wellness policy is to address student vulnerability to childhood obesity as well as other aspects of wellness. For example, one area that the federal rules on competitive foods and wellness policies has not definitively spoken on is food served at fundraisers and celebrations. the Oakland Unified School District designates in the nutrition section of its wellness policy that foods and beverages served as part of those activities, fundraisers, and celebrations must meet or exceed the nutrition standards that are covered at other times in the school day as well. An excellent resource here for school wellness policies is the Alliance for a Healthier Generations website, which provides a great overview as well as information on school wellness policies. Other organizations like the California School Boards Association, the Rudd Center at Yale, Bridging the Gap, and Action for Healthy Kids, and also us here at Change Lab Solutions are also preparing wellness policy tools. Just a quick footnote on wellness policies. The new requirements on wellness policies were introduced with the 2010 Healthy Hunger-Free Kids Act. The USDA is expected to put out its proposed rules later this year, and then folks will have a chance to comment on those rules with the final rules coming out later. The final rules won't be in place for schools to implement, certainly not for this coming school year. But schools, according to the USDA, schools should be reviewing and updating their wellness policies right now. So it's a great time to start working with schools and school districts on their wellness policies. The third intervention that we want to talk about is related to the one that I talked about with childcare and preschool. We have the example of farm to preschool. This is very similar, but here it's broader. The idea is to use the farm to school model that has been so successful and apply it not only to schools and school districts, but also work sites and retail. Basically, you are using policy systems and environmental interventions to bring local farms, farmers, and their products into the procurement system or the purchasing system by which organizations and institutions buy their foods. You often hear of these interventions as farm to plate, farm to fork, or farm to cafeteria programs. The partnership between the California Farm to School and between California Farm to School and the Community Alliance with Family Farmers is an excellent example of this. The partnership not only promotes the Buy Fresh, Buy Local program, which is the purchasing side of the equation, it also works to create distribution hubs that make the supply of fresh local products more available, easier to get, and more affordable. A number of excellent grant opportunities, tools for getting started, other resources, and success stories are available at the website California or CA farmtoschool.org. There's also a national farm to school website that has great stories and resources from around the country. Switching gears a little bit, another very effective intervention is joint use agreements, or sometimes called shared use agreements. In this intervention, schools and school districts enter into joint use agreements or have joint use agreements in place in order to share recreational, gardening, and cooking facilities, either with outside groups or with the city, municipalities, or individuals. This is especially important in neighborhoods that have less of these assets available to the public. Taxpayers are paying for school grounds, and it's a great win-win situation when agreements can be put in place to share the assets. One good recreation example in a very dense urban area is San Francisco. San Francisco, as most folks know, is the most densely populated city in California, and while there are many parks inside the city, they are not all readily accessible to all residents, especially lower income ones. Informal agreements have been in place for years, but it wasn't really until about 2007 that there was a coordinated effort to unlock school playgrounds at a number of key public schools, especially on weekends and holidays. The San Francisco example is important because whether you're talking about recreational facilities or cooking facilities or gardens or libraries, it's important to work towards district-wide partnerships, addressing maintenance, operations, liability, ownership, security and scheduling issues, and have regular meetings of the partners or the task force that's convened. Many of these issues, like liability, are very complicated and are addressed in our Playing Smart toolkit here at Change Lab Solutions. This toolkit includes whole chapters on liability, funding opportunities, case studies, and model contracts.
Thanks for that introduction, Q, to those first 4 strategies. I'm going to open it up now for folks who have been putting questions into the chat box, and please feel free to add any questions there that you might have right now around either child care and preschool, school wellness policies, farm to plate, or joint use agreements. I've got the first question loaded up here. Lisa asks, Q, can you discuss the reverse of shared use where schools use park and rec facilities? Do you have any examples of those?
I don't have examples here, but we have examples where folks, there are schools like the YMCA's or school districts often don't have a pool, or the YMCA doesn't have a pool and wants to use the school's swimming pool facilities, or vice versa. A school doesn't have a swimming pool and needs to use the Y's pool or needs to use a city or municipal pools, and that sort of thing comes up all the time. There are specific issues that come up with it when you're talking about outdoor spaces or indoor spaces. When you're talking about indoor spaces, there are often more complicated issues that you need to work through. But in terms of that sort of, is it just school grounds that are being unlocked? It doesn't have to be. It could be the reverse. It could be parks and rec that are being used by schools. We have examples of folks using church property. And even with that, there's also issues that come up around, a lot of the same issues come up. Just recently, one of my friends had parked her car in a church parking lot and noticed some kids throwing a softball around in the parking lot. And it became very obvious that that would be something that people would be concerned about. What happens if there's damage to a car that's illegally parked in a church parking lot and someone else is using that? You can cover these sorts of issues in your joint use agreement and have your partnerships talk about who's going to handle what aspects of the operations and the rules and the scheduling and any possible damage that may come up from something like that.
Great, thanks, Q. I also have a note here about thinking about shared use to include not just recreational facilities like you mentioned, swimming pools, et cetera, but also gardens. And we have some gardening examples coming up in the next few segments. I think that's all the questions we have. As I said, please, as we go along, if you want to pop those in there, we'll be taking them as we go. So I'm going to talk about our next intervention number 5, which is all about healthy corner stores. Here we're talking about healthy corner store certification programs that can establish and certify stores to improve grocery store options, so that certification programs are encouraging retailers to stock, promote, and market healthy options, including fresh produce. In Chula Vista, California, the Cilantro to Stores program works to increase access to local, fresh farm fruits and vegetables by working with 4 corner stores. The program has purchased and installed new equipment for merchandising and selling produce. They've helped establish a distribution network between local farmers and the stores, and they've provided technical assistance to store owners about selling healthier items. The Network for a Healthy California has provided nutrition education tools for customers. And really, community support has made this project successful. All 4 stores that Cilantro to Stores have been working with have agreed to continue stocking their shelves with local fruits and vegetables and maintain their efforts in the program for at least 1 year. Here at Change Lab Solutions, we've just published a new toolkit called Health on the Shelf, a guide to healthy small food retailer certification programs. This toolkit describes how to create a strong, healthy small food retailer certification program that requires participating stores to increase the variety of healthy foods they sell, reduce their offerings of unhealthy foods, and proactively market healthy options with help from a sponsoring agency or organization. It provides step-by-step instructions for developing a healthy certification program with ideas and examples from existing programs. This is hot off the shelf. It's a great resource. I encourage you all to check it out. Strategy number 6 focuses on improving the overall nutrition environment in low-income neighborhoods. One tool to track and measure progress over time is Communities of Excellence in Nutrition, Physical Activity, and Obesity Prevention, known as CX3 for short. CX3 can be used to answer questions like, are healthy food choices available and accessible to residents in low-income neighborhoods? How many fast food outlets are in neighborhoods and around schools? And what's the proportion of large to small grocery stores? They also can help you understand how much and what types of nutrition marketing messages are present in the environment and whether you can safely walk to a store and is it accessible to community residents. In Sonoma County, the local health department has created a recognition program for store owners who have CX3 scores of 75 points or higher. And actually their Board of Supervisors is starting a recognition program to honor a new crop of stores this year who have made healthy changes. And if you're interested in learning more about the Sonoma County model, they've produced a toolkit that explains the project and provides steps store owners and managers can make to become recognized as a healthy food outlet. Steps include things like selling good quality fresh fruits and vegetables, participating in the Network for a Healthy California retail program, and placing healthy items at the checkout area. The toolkit includes guidelines for participating as well as sample materials, and it's really a fabulous resource that helps walk store owners and managers through this process.
Great, thanks. Another intervention is to institute an organizational policy to offer structured physical activity programs in low-income settings or for low-income children, youth, family, and elders. Americans, both young and adult, do not get the recommended amounts of moderate to vigorous physical activity every day. This is especially hard in low-income settings where inadequate facilities or safety may be an issue. Programs like 100 Citizens, which is also called Role Models for the Future in the city of San Fernando, are great examples of how a fitness program can work in a city where 19% of the population is below the poverty line. Through free physical activity programming and culturally appropriate nutrition demonstrations, this program has worked, had things like a fitness workout in the city's public parks. It's run continuously since June of 2011. It uses exercise stations that are staffed by student volunteers, students in kinesiology, and has really helped educate in the delivery and benefits of physical activity. The program the basic fitness class is always free and is a very popular option. There are also some programs that charge a small fee as the programs expand into areas like Zumba classes or body sculpting or cycle spinning. All have a small fee, but again, the basic fitness class always has the free option. Another really powerful ambassador for physical activity in all communities has been our inspiring colleague Tony Yancey, who recently passed away. She was a pioneer of something called instant recess. And the idea here is that there are so many benefits that can come from getting whole groups of people of all ages to get up and be active for 10 minutes at a time. Actually today, at 1 o'clock Pacific time, there's going to be a national instant recess to honor and as a tribute to Tony Yancey. If you look up or if you Google "Get Up and Move to Honor Tony Yancey Nationwide Instant Recess," you'll see that our partners at Prevention Institute and a number of other organizations are putting together this, this national movement, so to speak. All right, I think this is you, Heather.
Yep, thank you so much. This is one of my favorite topics, talking about community and school gardens. We're talking about these places that promote opportunities to grow healthy, fresh produce where people live, work, and play. So just to share one example of a fabulous community and school garden example, in San Francisco, the Urban Sprouts program was created to increase fruit and vegetable consumption by low-income youth and adults. And they use a learning model that was actually developed by one of its co-founders to engage students and their parents and guardians in garden-based nutrition education and physical activity. Students who participate in Urban Sprouts report healthier eating habits, and their parents can receive training to become peer leaders, sharing knowledge with neighbors and even serving as farmers in residence. And here at Change Lab Solutions, we have a fact sheet on community gardens that describes the benefits of community and school gardens and steps that communities can take to protect and promote these community assets.
Okay, thanks, Heather. You know, I talked earlier, some of the interventions I talked about earlier today had to do with schools. And just as kids spend so many of their hours at school, most of us adults spend half or more of our waking hours at work. So another intervention that has been shown to be very effective is to have qualifying worksites self-assess and participate in the network's Worksite Wellness program. The network has an excellent collection of tools and resources to help employers develop and implement a culture and environment at their workplaces that support healthy eating and physical activity among workers. This kit contains 10 individual components, all of which have been evaluated by a diverse mix of businesses from across the state, and have been designed to be easily implemented at any worksite. These tools can be used individually or as part of a comprehensive worksite wellness program. Most importantly, the tools can assist employers and employees who are interested in combating declining employee health and ever-increasing healthcare costs. So this strikes at health, and it also strikes at productivity and also cost. Some of the areas that the kit includes, as you can see here, is wellness checks, wellness committees, healthy meeting policies, so that the food that's being served at meetings are healthy, vending machine food and beverage standards, as well as healthy dining menu guidelines. There's farm fresh produce being ordered for the work site, as well as healthy stairwells and walking clubs. The stairwell tool fact sheet is actually one that we used here at Change Lab Solutions to open up the stairwells in our own building here in Oakland. We started something called a flight club that worked with building management to convince them to open up the stairwells so that people could incorporate physical activity easier into the workday.
Thanks, Q. And as an active member of the Flight Club, I know I see people on the stairs all the time who not only are getting in a little bit of extra physical activity, but are also meeting each other here in the building, which I think is fabulous. Now we're going to just take a quick break for questions. If you want to go ahead and add any questions you might have to our chat box about healthy corner stores, healthy food retail, physical activity in organizations, community and school gardens, or worksite wellness, we'll take any of your questions on those topics. I believe we had one question about how the Model 100 Citizens Role Model for the Future program is funded. I have a partial answer to that, not a complete answer. I believe that this program has received funding from a variety of sources. They have volunteer physical activity coordinators, as Q mentioned, their students, kinesiology student volunteers. They also have received some sponsorship from some businesses, including 24-Hour Fitness, that donated spinning bikes to the program. And I believe that they also received some support from their city as well, since they're located in City Park. But we can follow up with more information on that. We have a question here from Austin about how the 4 businesses participating in Cilantros to Stores seen their bottom line affected. You know, Austin, I'm going to look that up and share that in the next question and answer period, because while the program has just started, I believe they have seen some initial success. And one of the things that I think was meaningful about the success of that program is that the store owners themselves were seeing increased demand from the community. I think that came a lot through the marketing and community outreach efforts that program undertook. So I'll share some specific figures in the next Q&A. And we also have a question from David. I think this one is for you, Q. Can you tell us a little bit more about healthy meeting policies?
Sure. There are a number of interventions that organizations or institutions or government entities can do to say we're going to make our environment healthier. You hear a lot about making the vending machines healthier. You hear a lot about the food that you purchase to sell in the cafeteria healthier. Another place that I'm sure many folks on this call find themselves spending a lot of time is in meetings. And meetings can be very demanding. And sometimes people love to get, cookies and brownies and all sorts of things at their meetings to kind of make the afternoon go a little bit faster. A lot of those things, there's a lot of research out there that shows that there are little changes you can make to the policies that you have for the meeting environment that will make that meeting environment healthier. You can have healthier snacks available. You can build in physical activity breaks. You can encourage people to get up and stand and move around when they want to. You can encourage people to incorporate physical activity into it. So it affects the meeting time itself and the meeting environment. And then when you start talking about organizational policies, if an organization says, hey, you know what, we're not going to use our meeting budget, our money, to buy cookies and brownies, we're going to use it to buy and soda, we're going to use it to buy fresh fruits and vegetables, and we're going to use it to buy to have water available and other healthy beverages. That's the idea here. And then if you go to this, the website that will be on the resources page, the network's Worksite Wellness, you can get other great ideas on healthy meeting guidelines and also how to put those into place.
Great, thank you. I see another question here from Jorge, who's asking, is there any funding available to improve or purchase equipment such as refrigerators for stores? That's a great question, because I think, as everybody on the call knows, that's not something that network funding is eligible to provide. So I was telling you about the Cilantro to Stores example in San Diego. They're located in San Diego County in the city of Chula Vista. And San Diego County was an awardee for the Federal Community Transformation Grant Program. So the Cilantro to Stores initiative drew on funding from the CTG, Community Transformation Grant Program, along with other sources of funding locally. So it was really a program that brought together multiple funding streams to pay for a variety of elements of the total intervention package. And the equipment in particular was paid for by that funding stream. Other funding streams might be available locally, and I think this is about looking to your partners to leverage funding sources that might be available in a variety of settings. So whether that's looking to other grant programs that a local health department might have access to, or whether it's partnering with your local community economic development agency to see if there are funding sources that they have for store improvements, that would be a good place to check. I think that's all the questions. Oh, go ahead.
Actually, Heather,
yeah.
I think I see that there was a request to repeat interventions 3, 4, 5, and maybe we could just quickly run through where we are right now. We started out talking about number 1, we talked about child care centers and preschools. Number 2, we talked about school wellness policies. Number 3, we talked about farm to school or farm to fork programs. Number 4 was joint use agreements, not just for recreation, but also gardening and cooking facilities and other types of environments. Number 5 was healthy corner stores. That was the cilantro, the cilantros to shelves example. Number 6 was the communities of excellence scores to improve the food environment, CX3. And number 7 was the organizational policies for physical activity programs. And I think that catches us up to the next one.
We had community and school gardens at number 8, and we had Worksite Wellness at number 9. So we're moving on to intervention number 10, which is safe routes to school. Strategy number 10 is about promoting active transportation for kids and families through safe routes to school. Safe Routes to School is a national and international movement to create safe, convenient, and fun opportunities for children to bicycle and walk, roll, or scoot to and from schools. The program has been designed to reverse the decline in children walking and biking to schools, which we've seen a dramatic decrease in kids using active transportation to get to their schools across the country. The example that I'm highlighting is from Marin County, which is actually home to California's first Safe Routes to School initiative. They use funding from the National Highway Traffic Safety Administration, the California Department of Health Services, and a local foundation for a pilot program, which was started by the Marin County Bicycle Coalition in 9 pilot schools. They did evaluations of biking and walking before and after their program implementation that showed a 57% increase in kids using active transportation to get to school. They were also able to use these findings to convince the county to formally adopt the program. And then later, Marin County voters passed a transportation sales tax that provides dedicated funding for crossing guards and safe routes to school programming. They now have programs throughout the county, and actually more than half of kids in Marin County get to school by either bus or active transportation, which is a big improvement from what they had before, which was a lot of kids being driven alone by their parents. And as a resource spotlight, the Safe Routes to School National Partnership has a really fantastic website that includes lots of information about case studies as well as information about how to build and sustain a successful Safe Routes to School program over time. Looking at Strategy 11, here we're looking at farmers markets and looking to farmers markets to improve low-income shoppers' access to markets and to increase consumption of fresh fruits and vegetables through outreach and nutrition education. And the example I want to share here, just so that folks are aware of it, this is a really great program. It's called Market Match, and it's taken root across California. The goal of Market Match is to encourage CalFresh recipients to take advantage of fresh, locally grown fruits and vegetables by offering an incentive that lowers the price of fresh produce. So Market Match is really a sort of umbrella program that works with different farmers markets across the state. Their partners promote the use of nutrition benefits in their markets and provide somewhere between a 50% to 100% match to increase the buying power of low-income shoppers who come to the market. So that means if they're offering a 100% match, if I spend $1 on fresh fruits and vegetables at the market, I get an additional $1 from Market Match to spend. Between 2009 and 2012, the program has actually increased CalFresh redemption at farmers markets by over 650%. And I think one of the things that I would highlight about this is funding for Market Match is provided by a number of philanthropic sources as well as a California Specialty Crop Block Grants program. So that's where the funding is coming from. But many markets have partnered with other funding sources to work on nutrition education, marketing materials, and outreach, which are all extremely critical to Market Match's success. And I'm very excited to share that Change Lab Solutions has a new resource just released this week called From the Ground Up, Land Use Policies to Protect and Promote Farmers Markets. This guide is actually updated from a previous publication, and it provides an overview of farmers market policy issues and community-tested best practices. If you want to learn about how you can craft policies to ensure that markets accept EBT, if you want to learn about how to have policies that support a variety of sized markets in your communities, from mini markets to big markets, this guide has it covered. It has a set of complementary land use model policies for comprehensive plans and zoning ordinances, and it also has a bunch of great new case studies. The policy language is updated, and it has great photos and exciting new look. So with that, I'm going to turn it back to Q.
Hi.
Q, I think. Yeah, go ahead.
Hey, sorry about that. I also saw that Lisa wanted to add that incentives need to be funded by other means that are not allowed by the network or not network allowable. I think that's in reference to the farmers market program interventions. All right, the last two interventions, 12 and 13, are actually have quite a bit of overlap with each other, so I'm going to talk about them together. Number 12 here is basically government procurement, and the idea here is to promote healthy beverage standards in places that serve low-income populations, and this would include county welfare offices, public housing units, city parks and recreational facilities, and or school vending machines. And also to provide healthy beverage alternatives in appropriate serving sizes. The network has a great fact sheet and resource on vending machine, food, and beverage standards, because that's usually the first step, is to decide, what standards you want to implement. The second thing is to start talking to folks, your key stakeholders in those settings, to see what people want to see in their vending machines, for example, what kind of beverages people want to see. So that fact sheet and resource is available on the network website, and will also be included in the resource page that's circulated after the webinar. The 13th intervention has to do with procurement also, and it's focused specifically at youth-serving organizations. And the idea here is to collaborate with local youth-serving organizations that are working with low-income populations. So this could be parks and recreation also, or other sports leagues or things like that. And the idea is to ensure that healthy foods and beverages are available at community events for purchase. The other side of this intervention is not just what you sell, but also what you're going to be advertising, or what kind of sponsorships you would be allowing to what kind of sponsorship partnerships you would be allowing to be affecting the environment. A good example of this, both the interventions number 12 and 13 together, is in the work that has been done by the Central California Regional Obesity Prevention Program. I'm sorry, this slide moved ahead. And the Healthy Eating Active Communities Program. So CROP, as it's known there in the Central Valley, created a cohesive policy and environmental change model that engaged youth, community residents, and healthcare professionals that have led to policy victories at the local and state level, and increased access to healthy food and physical activity. Another good example that ties the interventions number 12 and 13 together is San Diego's county healthy vending policy. In this Board of Supervisors policy, there's a requirement that 50% of healthy beverage options in all county buildings and facilities, including the ones that serve low-income populations, it requires that 50% of those beverages meet the healthy beverage definitions. This 50% requirement becomes 100% in facilities that attract a significant number of children, including parks and recreation. Furthermore, the County of San Diego, in its contracts and marketing agreements, requires that only healthy options can be advertised on machines and that they must be reasonably priced.
Okay, we're going to take a moment to do another quick quiz here, which is we've just talked about 13 interventions. That's a lot of different interventions. As Q mentioned, we're going to be talking more in depth about many of these interventions over the course of this webinar series this summer. But in the meantime, if you've heard about something that you're particularly interested in following up on, where can you learn more about PSE strategies to improve urban environments? So I'll pull up our quiz. Okay, I'm closing our poll. It looks like almost everybody suggested that you can learn about PSE strategies to improve urban environments at all of the above. Certainly in our SNAP-Ed Interventions, a toolkit for states, definitely at the Nutrition Network website. Any of the products that we featured on today's webinar that were produced by Change Lab Solutions, you can find at our website. Our colleague here, Livia, is going to be compiling links to every single resource we mentioned, and she'll be sending that out to participants. So all of the above was definitely a correct answer. I want to highlight a couple of resources in particular. So Q has been talking about healthier procurement policies and healthier vending policies. We have two resources that I just want to encourage people to take a look at if they're working in these areas. One is called Making Change, a guide to healthier vending for municipalities. And the other is Understanding Healthy Procurement, using government's purchasing power to increase access to healthy food. We also talked about two new resources looking at the retail and community environment. Health on the Shelf, as you recall, that was our new guide looking at certification programs for small healthy food retailers, and From the Ground Up, which was discussing farmers market policies to protect and promote farmers markets. Those and many others will be available after today's webinar. So we're going to open it back up for broader discussion and questions. I wanted to follow up a little bit on a question about the Cilantro to Stores program and how its business bottom line was affected. Actually, there's a great case study that was an evaluation of the beginning of the Cilantro to Stores program just between November of 2011 and January of 2012. So pretty short, about a 3-month evaluation. And I think for those of you who are listening on the call who have worked with retailers in the past, you know that working with retailers is a long-term strategy. It can take time to see business models shift and to see customers respond to new offerings. But in this particular case, the 4 small stores that they were working with had an estimated sales of produce of over $2,000 in that 3-month window. The store owners actually also noted that during the period of the evaluation between January and February, those are actually slow sales months for them. So they were going to be watching sales of produce going forward and looking for an increase in revenue related to that. But they also had some great quotes in this evaluation, including one store owner, Louis, who worked at Bow Bar Market and Gas, and he says more older people are coming in who didn't come before. They heard about it in the newspaper. Families walk in on their way to school, especially in the morning. Students sometimes come in and buy fruit. And I think the idea that customers for produce are primarily local residents who are actually the target of this Cilantro to Stores program is really a testament to the work that that community has done. And I'm happy to share a link to this evaluation for anyone else who's interested in finding out more. I also had a question about, I wanted to follow up about the question around how to pay for equipment and refrigeration in small store interventions. And Lisa helpfully reminded me about the California FreshWorks Fund, which is a healthy food financing initiative here in California. And the California FreshWorks Fund actually can pay for a variety of things, including construction and renovation loans, real estate acquisition and term loans, equipment loans, and inventory financing. It's not primarily a grant program, unlike the program I mentioned that Cilantro to Stores used, the Community Transformation Grant. The FreshWorks Fund is really intended to be a financing program, so that means that store owners are investing some in terms of equity into this program, and they're possibly paying interest on a loan. But the California FreshWorks Fund is a great resource if you're interested in looking for a funding source to pay for some of those pieces of an intervention that would not be supported by network funding, and I will post a link to that funding source as well. It's managed by NCB Capital Impact. Q, did you see any questions pop up that you'd like to respond to?
Yeah, there was an excellent question asking us to speak on food standards for government procurement as well, and I think that's an excellent question. When we talk about what the government purchases a lot of food all the time. It sells food to its own employees, to visitors to its buildings. It also has it serves it to dependent populations like students or inmates or patients, things like that. And what you will typically see is that food standards can be established. They're a little bit different than beverage standards. Food standards are usually broken into the type of meal it is. You have food standards for snacks, and you have food standards for meals. Underneath that, what you'll often see is that the standards then go down into the very familiar thing, how many calories, how much fat, how much sodium, how much sugar, for a particular meal requirement or a particular snack. And then you also have exemptions because, as we know, not all of the rules apply equally. Calories don't apply equally to things like nuts and seeds as to other food groups. So it gets a little bit more complicated, but the resources that we've highlighted, including the network's resources on food and beverage standards, are really good on walking through all those different standards. Working with low-income populations, it's also important to consider that food standards should not only be dependent on whether it's a snack or meal, but they may also change depending on the population that the standards are for. So I mentioned before there are dependent populations. Seniors may need different food requirements than juveniles. And so if you're talking about government procurement for some of these dependent populations, the type of standards that you use, you can start with the general standards, but it's important to make sure that there are specific considerations for the dependent populations. Another thing that's important to consider is a lot of times we break down these food standards into these formulas for calories, sugar, and percentages and things like that. Something that's a little bit easier sometimes is just to have a list of foods that meet the standards and a list of products that don't meet the standards. That takes some time to compile. There are some lists out there. The Center for Science in the Public Interest has just put out a list that meets their food standards, and that's really useful. It's also important with a lot of our work is to also consider culturally familiar foods also, and that you want to consider foods that people are familiar with.
Thanks, Q. I have another question on nutrition standards, and this one comes from Mary Jane. She asks, do any of your resources go over the resistant factors when making changes to vending machines? So how do you deal with making changes that might take away somebody's favorite food?
That's a really good question. People get very upset about this, and understandably. I mean, the food environment, changes are difficult for people. In our Making Change toolkit that Heather mentioned a couple of slides ago,
I'll pull that up while you're talking too.
Great, thanks. That toolkit actually has step-by-step approaches that you can take, and one of these steps is to anticipate barriers and to plan for them. And one of the first things that many successful places have done when they're changing things like vending is to do a customer survey to begin with, to bring in the folks that are going to be affected by this and to ask them if they want to see changes in their vending machines and what kind of changes they want to see. There's always going to be, I think, people who are going to be upset with change. There are always going to be people who are upset with not seeing their particular product represented anymore. But it helps to have other people, the voices of other people saying, hey, you know what, I want healthier options, and these are the type of options that I want. This is a large issue that comes up in terms of what percentage healthy you want to make your vending machines. A lot of places want to do 100% healthy, and then other places want to pick a smaller percentage than that and work towards getting to 100%. There are some different options that are possible to kind of work with people. And then there's also a lot of different framing kind of communications and messaging tactics that can be employed, just trying to make people understand that the bottom line here is that especially in government settings, what we're talking about is using public funds to sell food and what effect that food has on health, productivity, and ultimately healthcare costs, which again would be paid by the public.
Thanks, Q. I have one more question here from Mary, and Mary asks, what barriers do you see for families and communities to getting healthy food and activity or taking advantage of resources that are becoming available in the community? And I actually think this question really fits quite neatly with what you just suggested with related to vending. So to go back to an example we've been talking about, this Cilantro to Stores program, one of the first steps that program took was actually to survey neighborhood residents to ask about what interests they might have in seeing healthier options in these 4 stores. And actually during preliminary surveys in the community, they found that an overwhelming 90% of surveyed residents confirmed they would purchase fruits and vegetables offered at the stores, but they remained skeptical of the supplied variety and the cost. And I think engaging the population that you're working with, whether that's folks who are employees who are looking at a Worksite Wellness program, whether it's people who are neighborhood residents, if you're looking at a farmer's market or a healthy corner store initiative, engaging that community from the outset and asking them about both what they're interested in and also what concerns they might have will help you anticipate and respond to those interests and concerns as you develop your program over time. So that's not a perfect answer, but I think this survey from Cilantro to Stores illustrates that they both saw some interest and some demand on the part of the community. They're able to take that information to store owners, but they also knew that the community wasn't just going to accept the changes regardless of what the produce cost or if it wasn't high quality or if it wasn't the variety they were really looking for. So they knew in order to succeed they needed to meet people's expectations. I think, go ahead, Q.
Heather, can I respond to that also? I want to go back, because I think that's a really important question. There's one barrier, and I want to go back to this, one of the earlier slides, which is, all 13 of these policy systems and environmental interventions and all the different places they're affecting. And I think that the network strategy here is so important for two reasons, and both of them have to do with barriers. One of the barriers that you hear all the time, for example, if you're working in vending machines, is people will say, is changing vending machines really going to, change the world? Is that really the best you can come up with? And the simple, honest answer is no. That alone is not going to change the world. However, what we're talking about here is a number of different interventions that work together in all these settings. And it leads me to the second barrier, which comes up a lot, that I wanted to just mention, and that's what you may get some hesitation or some resistance from vendors. With procurement, and especially with the schools have come up against this, governments have come up against this, organizations have come up against this. They come up against vendors who say, oh, we can't do that. We don't have the products that meet your new standards. Or it's not profitable for us to do that, so we're not going to do that. And guess what? You're not going to be able to find we don't think you're going to be we don't think you're going to be able to find other vendors who are going to bid on this contract for this new healthy stuff that you want. But what we're seeing, especially in urban areas or areas that pool together their demand and aggregate their demand across all these settings, schools, retail, work sites, public places, neighborhoods, we're not just working on increasing the demand for these things, but we're shifting what the supply looks like out there, because vendors are ultimately looking to win contracts and make money in all these different settings. And so if they want to participate in that, they're going to need to change the supply. And so we're not just changing the demand here, but also the supply. And that's a good way of dealing with that barrier of the vendors.
Thanks, Q. That was really an insightful observation to wrap us up today. I want to let you all know that if you have any questions about anything you heard on today's webinar, you can feel free to contact your program manager or Betty Sun and Lisa Tadlock. We have their contact information here. We're happy to share it with you as well. As a reminder, the content of this webinar is, of course, for informational purposes only. And on behalf of myself and Q and our partners in the Network for a Healthy California, I want to say thank you for participating. Thanks for your questions and comments today. And I look forward to seeing you virtually at our next webinar event. Thanks, everyone.